All right. Well, good afternoon. Welcome to this community forum. We're at the Perry County Library today, and we're grateful that you have joined us. We're posting this program as well online on Facebook. So we hope those that could not join us today in person can follow along there. We're going to be sharing some updates about the 1115 Medicaid demonstration waiver, also known as Kentucky Health. A few of our other presentations that I'll mention. Douglas Beard is with us today. He is the director for the Division of Family Support within DCBS, and he's going to be talking about Kentucky ENT, which is a job training and skills program. And then also Teresa Dotson is here from Mountain Comprehensive Health Corporation, and she'll be talking about their services throughout the region. So we're grateful that they could be here today. I meant to go forward with the slides, but please send us your questions. We want to hear from you at any point during the forum. If you want to pull out your phone and send a message to the number on the screen, we'll do our best to answer those at the end. We'll have a short Q&A panel with our speakers today. So I guess our first poll question. I'm not sure if it populated or not, but we would like to know, who's in the audience today, where you're from, what best describes your role. I was able to speak with several of you beforehand, and that was great to hear from you all, and we're grateful that you were able to join us today. Just for some background, I know most are familiar with Kentucky Health, but this is our platform to improve the health and well-being of certain adults in Kentucky's Medicaid program. We want to offer a customized path for beneficiaries that will lead to better health and also engagement in the community. And the word health is actually an acronym helping to engage and achieve long-term health. So we want beneficiaries to be able to make informed decisions about their care, while also providing new skills and training to increase access to commercial health insurance. There are a couple of different components, as you can see up on the screen: cost sharing, a deductible account, a My Rewards account, PATH community engagement, and the KI HIP program. And I guess just for some background, you may be wondering, why the state decided to pursue this program, and it's really about improving health outcomes. Kentucky was ranked 45th in the most recent America's Health Rankings. We continue to struggle with issues such as obesity and smoking, cancer rates, preventable hospitalizations. So we want to encourage more preventative care and also provide Kentuckians with additional resources to improve their health and well-being. Another state goal, we want to improve workforce participation, promote self-sufficiency, through employment and training opportunities. You're going to hear about those today, and we're hopeful that PATH community engagement will connect Kentuckians with jobs and education, volunteer positions, and hopefully over time members will be able to transition to commercial insurance. So again, that's sort of our goal long term. Just kind of with fast forwarding, the Centers for Medicare and Medicaid Services approved Kentucky Health as a component of the 1115 waiver, but we do want to let you know there is a legal challenge, and the entire program has not gone live yet. Oral arguments are actually scheduled to begin this Friday before the U.S. Court of Appeals in D.C. In the meantime, we're doing our best to collaborate with our partners around the state to connect recipients to resources, both health and job related. Again, would love for you to like us on Facebook, follow us on Twitter. It's at Kentucky Health One. That's the handle that you want to search for, and we try to share updates not only about the program, but those that sort of connecting initiatives. So please follow us there. We also have a newsletter called the Kentucky Health Pulse. So please head to our website to sign up. It's kentuckyhealth.ky.gov. Another poll question, you won't be able to see that on your screen, but we would like to know from you today, just as we close out, kind of how you like to receive information. So we'll follow up with you on that. I did mention that the Kentucky Health Program is not live at this time, but we do have a couple of active components that we want to highlight. The KI HIP program, I might have gone past that one, was actually approved and implemented as part of the waiver. The KI HIP, and I think I'm on like an automatic, I'm not sure, I must have hit a some sort of automatic fast forward on these slides, but yeah. The KI HIP stands for Kentucky Integrated Health Insurance Premium Payment Program. So it's a very long acronym, but this is really a Medicaid program that helps members pay for the cost of an employer-sponsored insurance plan. And to be eligible for KI HIP, you have to have access to an ESI plan, either through current or past employment, or this starts in November. You must provide coverage to an eligible Medicaid member, and this could be like a waiver recipient through home and community-based services. Couple of numbers. I know the slide isn't cooperating with me, but a couple of numbers. As of late September, KI HIP had enrolled 180 members, producing an average savings of over $46,000 a month, or more than $500,000 annually. So we hope that will continue to grow. Next month, the team is actually going to roll out a standalone application that will allow more Kentuckians to apply. I guess we can go into kind of transition to our next program, which is My Rewards. My Rewards still accessible through Citizen Connect. My Rewards is kind of similar to a health savings account that could be used for non-medical vision and dental services. Potential Kentucky Health beneficiaries can earn dollars now. There are 71 courses, as you can see up on the screen, cover a wide variety of topics, but most are, health, life, workplace skills, and we're going to be adding some new learning opportunities in the next couple of months. Just the final update I'll share, and then we'll get to our presentations that we're looking forward to, is related to substance use disorder. Back in July, the Commonwealth expanded access to treatment and recovery services through a portion of the waiver. The waiver expands access to SUD providers, allows Medicaid to reimburse for short-term residential stays in mental health facilities, and also adds coverage for methadone, which is a form of medication-assisted treatment. And also for qualified residential treatment facilities, it will allow them to expand their bed capacity while at the same time elevating the program standards. So again, we're very excited about the changes, and are very supportive of expanding coverage and increasing access to care. I guess while we're on the subject, I also want to mention, if anyone watching or listening is in need of services, you can go to findhelpnowky.org or 1-833-8-KY-HELP, and that will get you to where you need to go. But we're gonna shift now to our local spotlights. Want to introduce Douglas Beard. He is the director for the Division of Family Support within our Department for Community-Based Services, and he's here to provide an overview of Kentucky ENT. So Douglas, thank you for being here today.
Good afternoon. I do appreciate the opportunity to go ahead and explain a little bit about the Supplemental Nutrition Assistance Program, Employment and Training, or SNAP ENT as we often refer to it in short. To do so, I'd like to give you a little bit of a history about SNAP ENT, where we are today because of where we have been in the past. While the program itself is not new, it has certainly undergone some changes in the recent past. When the program started, it was specifically for a group of people who had a work requirement in order to receive their SNAP. These individuals are the able-bodied adults without dependents. As the program grew, it continued to only serve that population. As our state began to face a recession, waivers were granted from the federal government in order to make these individuals exempt from that work requirement for a period of time. In 2018, those waivers began to expire, and the state implemented a new form, so to speak, of the SNAP Employment and Training Program. In doing so, we opened it up not just to these able-bodied individuals without dependents, but rather we opened it up to each individual who was actively receiving SNAP. So to get us where we are today, we have one remaining waiver that exists for the Pass the Promise counties. It is scheduled to expire December 31st of this year. And what we have done in preparation for that is we have trained all of our DCBS workers, as well as worked closely with our partners that are providing the direct service for the SNAP ENT program, and we have made sure that they are trained and ready to go. As of the first day of this month, the SNAP Employment and Training Program is a voluntary program open to any individual who would like to receive additional services as long as they are actively receiving SNAP. So these individuals who are between the ages of 16 and 59 are eligible for additional services. And as we prepare not only for those able-bodied adults without dependents, but for anyone else who would like to enhance their skills and become work ready, we do so understanding that the final waiver will expire at the end of this year. So let me explain to you a little bit about what SNAP ENT exactly is. It is a structured program that is tailored to an individual's current situation and circumstances, that enhances their skill set and prepares them with work readiness skills. This is done through training opportunities and work experiences. As mentioned before, this new form of the program is open to anyone who is receiving SNAP between the ages of 16 and 59. They are certainly eligible to participate in this added benefit through the program. How does it work? Based on results of an assessment that identifies goals, education, and barriers to employment, SNAP ENT provides opportunities to gain skills to further education in specific training or work experiences such as a job shadowing or an on-the-job training. These activities are aimed to increase an individual's self-sufficiency and support long-term employment in high-demand industries. And where is this program taking place? As mentioned, as the first day of this month, the program is operational in all 120 counties. The SNAP ENT program works because we partner with individuals. In the Pass the Promise counties, not just those 8, but as a matter of fact, in 56 different counties, our direct service provider for the SNAP ENT program is the Big Sandy Area Development District. At this time, I would like to give them just a moment to explain about the specific components that exist in the program and what they do with an individual who does voluntarily participate and wants to increase their skills. I'm going to introduce you to Dan Gullum.
My name is Dan Gillum. I'm with the Big Sandy Area Development District. Whereas we are relatively new to the SNAP ENT program, we started with July 1. We became introduced to it. We have a long history working with the KTAP population for Kentucky. We do cover 56 counties in the state of Kentucky, so we have a large coverage area. We've been successful with the KTAP population, getting them to work, employment and training. Due to the way we approach it, we approach every person as an individual. Every individual has a certain want, a certain need, a certain set of barriers, and a certain set of skills. So we meet with them one-on-one. We work with them and to help them to provide an employment plan, a plan of action where it gets them moving in a positive manner. And from then we can help them to become more successful. There are many employment opportunities. Sometimes they're hard to find. Here in Eastern Kentucky, they're not so easy to find. But we have employment specialists in each of our counties that lives here, they work here, they know the area, and they've become, have very good, close personal relationships with many employers. and they are able to help that individual to find those jobs and become self-sufficient. We work with a lot of ENT providers, partners that have been set up throughout the state. We work closely with them. Each one of those have a certain amount of, they bring a certain something to the table. They're able to help with training and skill sets, and we work very closely with them. We believe in the team approach to working with people. We can't do anything on our own. It takes a lot of people to help, to get involved, and we're really good working with community partners and all the resources that's found in our area to help these individuals. And over the years, we've been able to put thousands of people to work in the KTAP population, and we're looking forward to working with the SNAP ENT as well.
Thank you, Dan. So as you can see, this program is dependent upon the partnerships that we build, not only with Big Sandy Area Development District, but through what is known as our 50/50 providers. These are individual entities that have contracted with the Department for Community-Based Services in order to be matched, in order to receive additional federal funding, in order to support an individual's expansion of their skills as they prepare to get back into the workplace. So as you can see, there are some additional benefits that exist for individuals who voluntarily want to participate in the SNAP ENT program. As Dan mentioned, if you are part of the program, there is an opportunity for you to receive one-on-one career counseling and job coaching. Our Department for Community-Based Service workers don't always have the capacity to provide that one-on-one assistance in talking about job development or talking about skills growth or trying to even set goals with a client to understand what they might want to do with their future. So it's important that we have the partnerships like we do with Big Sandy Area Development District so that they can really get that one-on-one touch and so that they can really understand the barriers that a client might face and be able to direct them in the right component for their SNAP employment and training. Some other additional benefits that exist as part of the SNAP employment and training program: a previous rule that had made full-time students ineligible to receive SNAP benefits has recently been changed for those individuals who are participating in SNAP ENT and who are also enrolled in a vocational training program through one of our Kentucky community and technical colleges. Also, another benefit that exists would be for those who are voluntarily participating again in SNAP ENT, but also have an activity requirement for their child care assistance program. SNAP ENT does qualify to meet the requirement for anyone who does have that child care assistance program requirement. So we're excited to say that there are many benefits in participating in the program. As we roll out as the last waiver is lifted on these 8 counties, which include Bell, Clay, Harlan, Leslie, Letcher, Perry, Pike, and Whitley, we do recognize that there are some unique challenges that our residents of Eastern Kentucky face, but we also champion that there are some assets that exist within the culture that is here. In our conversations with the Big Sandy Area Development District, as well as the DCBS workers from the local Perry County office, we began to understand about a culture of compassion, a culture of community, of working together, and we believe that these are going to be great assets in helping to develop this program and also to help develop individuals to recognize their value that they are to the state in the workforce system, to recognize the accomplishments that they can achieve and the growth that they can experience specifically through our SNAP ENT program. This time I'm going to go ahead and turn it back over to Jordan, and he will introduce the next individual that will continue the program.
Jordan Rowe with the Cabinet for Health and Family Services again. Really appreciated Douglas and also Dan from Big Sandy presenting on Kentucky ENT. Our next spotlight is going to be Mountain Comprehensive Health Corporation. Teresa Dotson is Director of Financial Affairs and is here to present about their services today. So Teresa, thank you so much for being here today.
Thank you all so much. Mountain Comprehensive Health Corporation is a large FQHC located in Letcher County, Kentucky. We also have clinics located in Bell, Harlan, Perry, and Owsley counties. Currently, we have over 390 employees, including over 65 providers. We last year gave services to over 41,000 patients, 220,000 times. We also have school-based clinics in the Letcher County Public School Systems, Jenkins Independent School Systems, the Owsley County Public Schools, and also Pineville Independent School System. Just a kind of a snapshot of what our clinics look like. As you can see, the Whitesburg Medical Dental in the top corner, that's our largest clinic. We have the Harlan Medical Center, Leatherwood Blackie Clinic in Perry County, the Owsley Medical Dental Clinic, Buckhorn Medical Clinic, the Isom Medical Clinic. We just recently opened the Middlesboro Clinic in Bell County, Kentucky. We have Pineville. We also have the Cumberland Medical Dental facilities. Just some of the services we offer. We have just basically anything you need anymore. We're very proud of the services we're able to offer to our communities. You can read them for yourselves, but we have family, internal, pediatrics, OBGYN, dental services. We have pulmonology, including pulmonary rehab. We have optometry services with an on-site lab. Kind of cool for patients. You can get your glasses sometimes, mostly same day or in the next week, even from Owsley County. It's all electronic now. We have behavioral health services, including SUD treatment. We have podiatry. We have on-site high and moderate complexity labs. We have x-ray and imaging services. We're very proud of our commitment to health and preventive care. So we have mammograms available. And for example, this month, any mammogram performed, no matter of insurance or anything, is $45. So that's our commitment. That price will never be a barrier. We have nutrition and diabetic education, which we'll focus on in just a minute. We have telehealth services available, a 340B discount drug program, sliding scales on there as well, indigent medicine, enabling services, outreach and enrollment for Kentucky Health and Benefund. We focus a lot in our community. We just had a huge Healthy on the Hill event, locally tied to our festival at the Mountain Heritage, where we've done a huge health fair with over 30 booths for patients' participation. We have an after-hours nurse advice line, and we also have the pharmacy program. Just a timeline, just showing how much we've grown in the past several years. Currently, we have 6 assisters to assist patients with questions on Benefund or any Kentucky health questions. We assist over 150 patients a month. In the last 3 months, we've had over 1,000 assists and enrolled over 100 people in coverage. So a lot of questions out there. I'm going to focus now on some of the programs that we are able to offer our patients. MCHC likes to focus on preventative care. We want to fix what happens before it becomes a huge problem. And as part of our commitment to that, we offer a chronic care management program. You can see the little card on the right-hand side. If you're enrolled in this, you're considered a platinum member. So you have your own care management team. We created this back in January of 2016. We currently have 269 patients enrolled. As I stated, they all have their own assigned care managers, and those become more like family than they do just a name or on the phone. We have decreased ER utilization. We have had several positive health outcomes, and the patients are contacted monthly to assist with any needs such as the disease management, education, referrals, appointments, and other medical needs. We've helped get meters when needed, or make those connections to appointments, and transportation is a big issue here in the mountains. So our assisters and care managers are able to help the patients connect all their needed services, kind of like the hub. Another program that we're very proud of is we had these little take care of your health cards. I always joke that when I'm in a waiting room, if you give me something to read, I will read it 100 times. So again, based on our focus on preventive care, this card basically has all the services that you need based on your age and just what's out there. unless I worked in the healthcare field, I honestly probably would not know what I needed every year to just as a preventative service. But this is also an reminder to the provider, because when a patient comes, most of the time they're sick. They're not interested in trying to fix themselves before something happens. They have a problem right then. So this is one of those ask your provider about cards, and it also triggers a conversation. We've had some pretty good successes with this, and we've actually, patients have agreed to have FIT testing, which is a colon cancer screening test, and honestly, there have been several cases where stage 2s have been found due to this. So we're very pleased with this. Staff involvement, we have a little tear-off card for the patients to do a registry, and the dietitian gives away a basket from all the participants once a month as a drawing with a healthy recipe and the ingredients in it. So just something small. Something else we do is a nurse advice line. We are open at most of our locations quite a lot of hours, and we're expanding as we speak. But just in case it's in the middle of the night, I've had to call it for myself or my son. There's a nurse advice line available for patients. There's also a 340B drug savings program with participating contract pharmacies. MCHC has also taken part in a group called, we call it HEAL, but it's Help End Addiction for Life. The main partners are MCHC, ARH, and ARC, along with the local court systems. What we've been able to do with this is connect patients to treatment. If you have heard anything about the Letcher County system, a lot of times the judge will actually go ahead and instead of put them in jail, they'll send them to treatment if possible. So we've been able to work together with Accept and other groups, and SOAR especially, and Unite, to bring everybody together in one forum. And the next meeting on that, by the way, is October 28th at 5 o'clock at Southeast Community College, if anybody's interested. A lot of work has really went into this, and a lot of successes are told. So, something else we do, we have a huge comprehensive diabetes program. Being in the mountains, it's kind of a foregone conclusion. You know, you hear about it all the time. Everybody has sugar. It's in my family. So as part of our commitment, we have a diabetic dedicated management staff. We have a licensed diabetic educator. We have licensed diabetic facilitators. We have a dietitian on site. We have regular diabetes self-management courses. We use iPros as a device for patients to see exactly kind of what's going on, and it helps the provider steer the patient. For example, we had a patient that came in and said, something's wrong. My sugar keeps bottoming out on me. And what we realized was it was what she was eating at a certain time and the way the medicine was. So they're able to make those adjustments just by those graphs. So it's been a very instrumental tool in diabetic management in our practice. And we also have a community health worker program that goes into the homes. A little bit more about that. That is a Marshall University managed and funded by Merck Foundation grant we have. The CHWs provide a weekly patient visits to help the monitoring of the diabetes. We've seen some significant drops in A1Cs in this. We currently just have 34 patients participating, and we have 16 waiting to be intaked. You can see there we've already had 78% of the enrolled patients decrease their A1C by 1.6%, and 81% from March to June. So these patients are supplied with educational materials. We've gave them container gardens, and truthfully, it's just showing them simple things on how to actually just measure the medicine correctly. We had patients not doing the shots correctly, so the community health workers are trained to assist in those functions. And a lot of it is, like I said, it's back to the education, in my opinion. MCHC started a pharmacy program with an F several years ago, and basically it's a produce prescription program. We're able to provide fresh fruits and vegetables to patients who qualify. And honestly, it's just been a great project for our communities. It not only helps the patients out, but it also helps the farmers, and the farmers markets have grown due to the participation in the counties. I mentioned our dedication to population health and improving management. In that, we formed a quality care management team in October of 2014. This team does nothing but try to get the patients in for care that they need ahead of time before it goes bad. We partner with insurance companies. We partner with the providers and trying to make sure that the patients come in on time, and let's find it before it gets bad. We do that for our own employees as well. We focus on, we practice what we preach. And when I say we instituted innovating programs to encourage health, we actually do programs such as diabetes walks and talks. So at the local rec center, we have certain times that our diabetic facilitators are eligible to walk the patients and they just talk about things like their recipes or their problems that they're having. So we just like that type of commitment to our community. What we have done with Kentucky Health, we discovered whenever we first started talking about this that communication is key. So we collaborated with the Kentucky Health implementation team early on and the managed care organizations. We focused on training the staff, but that way if the patients had questions, we would to be able to answer those or at least find them who to talk to. It is confusing, as you all know, especially for people who aren't in the healthcare field. So it's just finding who to talk to for the right answers. We do have assisters, dedicated at each location for patients with questions. We focus on patient education calls. We have worked on education. We have done scheduled the preventive visits in. We have created patient focus groups just so we can see the patient's perspective as well. And their understanding level of what's been going on. And we've hosted patients to see what their understanding of the insurance changes are. We've had community forums ourselves at local restaurants. We've had teams come in and just be able to question patients that one-on-one down in the trenches. So that's MCHC, and I would welcome anyone to come visit. If you have any questions, please feel free to contact me. Thank you.
All right, thank you so much, Teresa. I think we're now going to go to a question and answer panel just here at the front. I think maybe some submitted questions, or if not, we'll be glad to sort of expand upon the presentations. And we have Douglas Beard, who's Director of the Division for Family Support with DCBS, Teresa Dotson, also Big Sandy, if you could come up to the front as well, just again to entertain a few questions. I'm going to rotate down to the front of the stage, and we'll continue the program there. So. Right. First question we have is really for Teresa, and you hit on this in your presentation, but person would like to know, what is Mountain Comp's role in assisting with sharing information about Kentucky Health?
Originally, what we did is have stations in every location, and then also the assisters are educated in each location as to what's going on and how to get answers.
All right. Fantastic. We'll go to our next question. All right. This question asks about resources that are available now for Kentuckians to utilize. Question is not specific, but I guess maybe each of us, we can talk about resources that are available. I guess from the Kentucky Health side, we have our KI HIP program, which we mentioned for those to have access to a commercial insurance plan. We also have My Rewards. We very much want people to accrue dollars there, and there are some really beneficial courses regarding health and well-being and life skills. And so those are two elements that we want to point folks towards, and then also substance use disorder, expanding access to treatment and recovery services. But you gave us a very nice comprehensive overview of Mountain Comprehensive Health, but what any in terms of additional resources or kind of, I guess if you can talk to us about if someone comes in the door, what services you're able to provide
Sure. We actually, the sisters also can act as finance counselors. So we truly try to see if we can sign them up on insurance if they don't have any. And then they are trained, I think, how to work on the portal with the Kentucky Health and My Rewards. So they're able to help patients, I think, navigate through that. So
Wonderful.
as part of their training with the state.
Right. Wonderful. Dan, I'll maybe pass the mic to you and have you touch on Big Sandy again.
Well, when someone comes in for SNAP ENT assistance, we work with a lot of different partners in the community, local partners. We work with, they may have issues with dealing with basic needs, some basic barriers that they're trying to overcome that would allow them to be able to go to work and go to and use training. So we work with a lot of different agencies. We work with churches. We work with food banks. We work clothing banks. We work with a lot of different agencies to help them with that. We also have our 50/50 partners that we deal with, and they can help with trainings. We also have employment trainings that we can put on, a job readiness training, and help them to move towards self-sufficiency.
I believe the question was about resources. So for any individual residing in the state of Kentucky who is in need of public assistant resources, I would encourage you to go to benefind.ky.gov. That's benefind.ky.gov. In doing so, there is a universal application that will actually allow you to apply for 4 different programs at the same time. That's going to be for SNAP, which of course is a food nutritional benefit that allows you to purchase groceries. Also, there is a TANF benefit, which here in the state of Kentucky is referred to as KTAP. Also, this is within that same application, you will have the ability to apply for Child Care Assistance Program if you are in need of that. And the final component of that application is, of course, Medicaid. So that's one application, again, at benefind.ky.gov that encompasses multiple resources. So I would encourage you to check that out.
Dan, you touched on this, but another question we have is how you're addressing barriers that Kentuckians face obtaining work, reliable transportation, and child care.
That is the hot question. It is more difficult here in rural eastern Kentucky to handle those situations. We try to think outside the box so we can. With our KTAP population, transportation has always been a problem. We got people that's a long ways away from more populated areas, and it's always been a problem. We've been able to use things that are already there. Get creative with transportation. You get somebody to, we try to help them think through the process. Maybe there's something already there. Maybe there's a person that can give you a ride. Maybe there's someone that you can work out a deal with them, share rides. There's a lot of different things. There's no cut answer for that here in eastern Kentucky. I wish there was. I know that there are some towns here who have a bus program, and they're very few and far between, and you have to get on a certain schedule. They're very difficult. But there's no really good answer for that. But our local worker is very good at working with people to help them come up with those creative solutions. We've heard of some really creative things people can do, and if you have 2 people that happen to work at the same place, you can share rides. There's no really good answer for that question, but we're still working on it.
Another question, will the state appeal if the ruling in October is in favor of the advocacy group? I can say the cabinet is very committed to implementing Kentucky Health, and we truly believe that this is going to be a valuable program and improving health outcomes and overall well-being, helping people sort of climb the ladder in life, improve self-sufficiency. So we're very committed to implementing Kentucky Health, and of course we'll. In terms of the legal case, we'll be following that closely, and we'll be in touch, and we'll continue to update via social media and our website, which is kentuckyhealth.ky.gov, with additional information on that front. So those, I think, are the questions that we have. Is there anything else, Douglas, Dan, Teresa, is there anything else you'd like to add?
I would just add for those who are in attendance here in the auditorium today, as you exit, there is a one-pager that can give you a little bit more information as far as the details around the SNAP Employment and Training Program. I would encourage you to take that with you. Also, I had mentioned previously about the 50-50 partnerships that can exist with entities that are already serving clients in this capacity, helping them to gain job skills. If you are interested in becoming one of those 50-50 partners, I also have some information available for you as well. So I would say to see me after this.
Terrific. Well, if there are no other questions, we will, all of us will be around afterwards. If you would like to ask some follow-up questions individually, we would be happy to provide more information and guidance. So we're appreciative that those of you that have joined us via Facebook Live for this broadcast. And again, KentuckyHealth.ky.gov will be sharing more information there. But again, Jordan Rowe with the Cabinet for Health and Family Services here in Hazard. And again, want to thank all of our presenters for being here today. So, and thank you for attending.